We begin tonight with the nurses' strike, which began at 7 o'clock this morning and will last for 24 hours, almost 3 decades after the last such strike. Remember, the New Zealand Nurses Organisation recommended acceptance of the revised deal DHBs put to them, total value over time $500 million. Their membership voted no, and today thousands of those members marched. We joined them with our cameras. You can watch this story now live on Facebook, on Freeview Channel 50 and on Sky TV Channel 83, or later on the Checkpoint website, or of course you can listen to it on the radio. Later, our health correspondent Karen Brown surveys the day across the country. It appears to have passed relatively smoothly so far. But with such a large offer being declined over the top of the union's recommendation, why did nurses strike and what do they want? The best way to find out is to ask them directly, so our cameraman Nick Monroe and I joined the thousands marching through downtown Auckland to do exactly that.
Kia ora, ko Marianne mohi toku ingoa.
Really nice to meet you.
Nice to meet you too.
We're in Aotearoa Square, downtown Auckland. It's approaching midday and the nurses have marched up Queen Street. More from the march itself shortly. But first, some figures. How much are you paid, roughly?
I'm on roughly about $27 an hour. I have a sister that's working in a factory line that's on $30 an hour. So, and she's not qualified whatsoever. I've had to work hard for my qualifications. I have to work hard with placements. I give of myself freely before I become a nurse. So I've worked hard and I'm just not being compensated.
Under the offer, Marianne would have received 3% this year, 3% next August and 3% in August 2019. But she's new and that's on a relatively low base. How long have you been a nurse for?
I've been nursing now for 5 years. So I'm only a junior in the ranks, but I'm already seeing all the discrepancies that are out there, and it's putting me off, and I'm thinking, gee, is there something better? But I want to be a nurse, I want to be helping, but I'm finding the government's not finding a way to do that.
The government, of course, and the DHB say this is fair, this is substantial. We are listening and we are prepared to write cheques in response to what we're hearing. The government's saying, hey, there's $500 million on the table. We are recognising you.
No, too late. We want it now. We want it now. Too late.
Margaret has been a nurse for 24 years. Angela, who we meet later, even longer. Why are you on strike, Angela?
I'm on strike because the same thing is happening today as happened 28 years ago. We don't have safe staffing, we're not being paid properly, and our patients are daily at risk.
Were you a nurse 28 years ago?
I was a nurse 30 years ago.
And did you go on strike the last time nurses went on strike?
Yes, I did. And today shows us that we're in exactly the same position and we're fighting for exactly the same reasons. And the number of people here shows you that we've got the same causes.
What are the most important reasons?
It's about safety. It's all about safety.
And safety means what? Well, staffing levels first and foremost. And that means recruitment and retention. And that means money. It's an inexact survey, of course, with a loaded sample, but that theme recurs all morning. I've spoken to about 20 nurses, maybe slightly more, during the course of the march, and they all say, yes, we want more money, but the point they overwhelmingly return to is we need more staff.
We're tired, we're shattered, we can't cope any longer. We're underfunded, we're under-resourced.
I think the DHBs and the government have actually said they agree with you. All of those things are true, and they've put $500 million on the table. So what is it you want now? What more? What will make the difference?
The difference is the conditions, John. Most of us have said, you know, pay is really important. We're way behind other people. But we work in an environment now where constantly we are being provided with short staffing. They need to find those nurses and they need to pay us fairly because they're leaving in droves. They're going to Australia, they're going elsewhere where they feel valued and paid fairly for what it is they do.
What is it you're after? Why are you on strike?
The nurses on the wards, I work in critical care, so we're well staffed, but the nurses on the wards are really struggling with safe staffing levels. On night shifts, some nurses are being asked to look after 10 patients in a night, and that is incredibly unsafe, both for nurses and patients.
We've gone back in time a bit. Before the march has even started, we're assembling on Fort Street. But over the course of the morning, this will be repeated over and over again. What's most important to you? What is it that you most want from the DHBs?
safer staffing.
Why are you here today?
I just want to support better staffing and better pay for the nurses because we totally deserve it.
How long have you been a nurse for?
4 years now.
Why did you become a nurse?
My nana's a nurse, my nana's mum's a nurse, my mum is a nurse, but I just wanted to be there to help people. And that's the real passion behind nursing, is we just want to be there to help.
And that's the issue here. The pay round, which is very personal, is now conflated with the greater good. Public health, patients, safety, those big words. On the one hand, nurses want more money. On the other hand, they want more nurses. How long have you been a nurse for?
30 years.
And why are you on strike today?
We're striking for our patients, and we're also striking for better pay.
The government is saying, hey, $520 million, admittedly over 3 years, is a hell of an increase. What more are you hoping for?
Well, a part of that increase they're saying is for nurses, extra nurses. That's $38 million they've allocated to that. That equates to 2%, which is basically one nurse, not even one nurse, per ward, which is nothing because the wards are grossly understaffed anyway.
Are they?
Oh, you've no idea. No idea.
Tell me about it. How does that manifest itself? How is that seen?
I think it's seen in that we just can't do our jobs properly. We're all professionals. We all care about our patients. And if there's not enough of us, we can't actually look after them how we would like to look after them.
And on it went. Colleen has done 25 years and worries that her beloved profession is not appealing to young people as it once did. The government's saying, hey, we're putting $500 million on the table.
I know, but they're buying airplanes and things as well.
So what more do you want? What would make a difference?
I just wanted safe staffing more than the fair pay. A bit more pay just to encourage people. You know, nursing students coming in with 3 years student loan and getting as much as a top grade healthcare assistant. It's not fair.
Fight back! When patients' rights are under attack! Stand up! Fight back!
There was a sense this morning of accrued frustration, mounting anger, years of being underwhelmed now adding up. A new government has inherited old grievances.
Well, at the moment, we haven't even been given a deal which will take us back in real terms to what we were getting in 2004. So if they could at least match that so that we haven't been taking a pay cut for the last 15 years, that'd be a start.
So why are nurses striking now? Why weren't you striking 5 years ago, 8 years ago, 10 years ago?
I think at this point it's become a crunch point. So every year we've been taking a pay cut and every year we get further and further away from having living pay and good working conditions. We've got less nurses on the floor. I think it's just become a crunch point.
Crunch points. There are nurses here today that weren't born when nurses last went on strike. $500 million on the table and a government that largely agrees with them in principle, but not yet clearly in persuasive enough terms.
They need to find those nurses and they need to pay us fairly because they're leaving in droves. They're going to Australia, they're going elsewhere where they feel valued and paid fairly for what it is they do.
I'm looking after the community, but who's looking after me? Who's looking after my family? So it's really not fair.
Nurses marching through Auckland late morning and around lunchtime. Nick Monroe, the cameraman, doing a stunning job there.